Hey there, Dr. Luch here, and today we're going to go through a hip capsular CARs, an axial rotation of the hip. And this is really important, especially for the shoulder and the hip. To get this rotation, we're not going to have really good function of the whole joint if we don't have good rotation. So what we want to do here is we want to really stimulate the joint capsule so that we're getting those mechanical inputs into that area so that we can make those physiological changes to the joint capsule and get better joint health and movement. So we do that by irradiating, by increasing our abdominal pressure, and that allows us to just really go slow and controlled, squeezing that movement and really getting that intensity up there and stimulating the tissues. So first of all, what we want to do is lay on our back. We bring our hip up into that 90 degrees. We're going to imagine that we've got a pole through our femur there, and then we're just going to do our axial rotation through that area, through that hip. So breathing in and irradiating, and then we're going to internally rotate the hip and then externally rotate the hip. Really nice, smooth, slow movements. Really try and increase that intensity through the. We can also do this in maybe 10 degrees, internally rotating, externally rotating, internally rotating, externally rotating, and we can go into full abduction there and doing the same movement there. We can also do this in the standing position and the side-lying position as well. So if you would want to come to our side-lying position, bring your arms out in front of us so that we're not going to rotate through our whole body, and then just bringing the leg up into this position. And then we're going to internally rotate and externally rotate. Really slow and controlled, irradiating, really pushing, getting that intensity through there so that we're really stimulating the tissues there to get that rotation and back to that joint. Great, so we can do that. We can also do it laying face down, bringing the leg up into that 90 degrees, internally rotating, externally rotating, internally rotating, externally rotating. And if we want to focus on just internal rotation, bring our hip into this position, and then we go into that internal rotation there and just lifting, squeezing, increasing the intensity, slow, nice and smooth, slow, controlled, really squeezing for that outer range and getting that movement. So it's really important that we do this every day, especially if we have problems with our hip joints. Consistency is the key, intensity is the key, and that's the way that we're really starting to heal and get movement to that joint. And that's how you do a capsular CARs of the hip.